What is bad Botox? Welcome to Dr. Scheiner's Medical Minute. Today we're going to talk about the finer points of Botox treatments and why many injectors of Botox inject it wrong. Botox treatments are great for softening smile and frown lines, and when used in an expert manner, it can even be used to create a brow lift effect. Many different types of medical professionals can legally inject Botox, but most Botox practitioners don't have great knowledge of facial anatomy and the effects of Botox on the body. As a result, they can cause their patients to experience irregular results. One example of this involves forehead lines. Many patients don't like forehead lines, but they are often an example of an effect rather than a cause. Let me explain. Forehead lines often appear when our brows start to fall into the eyelid space. This can happen with age and sun exposure. When the brows are relaxed, they fall into the eyelid space, but the brain then subconsciously pulls them up with the forehead muscle called the frontalis muscle. When the unsophisticated Botox injector treats the forehead lines, primarily, the effect is a relaxation of the frontalis muscle and a falling or descent of the brows into the eyelid space, resulting in heaviness above the upper lids. This new heaviness is the last thing that patients would expect from a cosmetic Botox treatment. The best way to inject Botox in these circumstances is to treat the muscles that pull down the brows first. This results in the brows rising naturally. Only after these muscles are treated can some Botox be placed in the high parts of the forehead. The middle part of the forehead needs not to be treated so that the brows don't fall after treatment. The second mistake Botox injectors make is not injecting enough units to get a complete result. By undertreating patients, the results are incomplete and don't last long enough. This results in frustrated patients. The third mistake of Botox injectors involves diluting the Botox with more saline than necessary. For example, one injector might mix the Botox, which is freeze-dried, with 1 cc of saline, where another might use 2 to 4 cc's. The same units can be injected in both cases, but the one with the higher dilution has to have more saline accompany those same units. This can result in large swellings in the areas of Botox injection, and the extra liquid saline allows the units to move around more, resulting in Botox affecting unexpected areas. This is one reason many injectors don't completely inject the corrugator or frown muscles, which cause vertical lines between the brows. They are nervous that injecting the full muscle will result in Botox drifting into the eyelid lifting muscle, which can cause the eyelid to droop after Botox treatment. If they only understood that by using a concentrated Botox with less dilution that they could safely treat the full corrugator muscle, then they could offer their patients better results with their Botox. The fourth mistake of Botox injectors is not using magnifying loupes when injecting. There are many vessels below the skin surface in the areas of Botox treatment. Hitting these vessels results in bruising for 2 weeks after treatment. Our patients don't want to have bruising. By using good overhead lighting and magnifying glasses, it's possible to see the vessels and inject between them to treat a specific area. Results then result in great results and usually no bruising. I call this technique of avoiding vessels walking between the raindrops. These are the 4 mistakes patients and practitioners make with Botox treatments. To get the best results, seek out injectors who use the least amount of dilution with the Botox, which is usually 1 cc per bottle, who know their facial anatomy, and who use magnifying loupes and good lighting when injecting Botox. Injectors who follow these key steps are usually the best people to see for Botox treatments. I hope you found this interesting. Come back to watch again for our next Medical Minute. Goodbye for now, and I wish each of you a beautiful day.